Herded Health is sponsored video content brought to you by MedCity News.
Hello and welcome to Herded Health. I'm Katie Adams, a reporter with MedCity News, and I'm here with Dan Scher,
Hi.
the Chief Product Officer at Quantum Health. Hi. So Quantum Health is a healthcare navigation and coordination company, and you just did a survey, a report with MedCity News that I want to talk about. Per that recent index survey, we found out that healthcare navigation market really is heating up. So can you talk about why that is and explain the challenges that employers are still continuing to face?
Sure. The index was a phenomenal way for us to gather some feedback from employer benefit consultants. You know, working day in and day out with the employers, and we learned a lot from the survey. Okay, really insightful for us in that what we heard from the benefit consultants is that the jobs are changing, that they are asked to get more involved in the point solutions and the ecosystem space, and to help the clients understand which ones to use and when to use them. And so this really dovetailed nicely into what Quantum does. And over the course of the past 20 years, we've worked with over 700 of these digital solutions, and we've learned a lot. We've learned which ones are applicable for which situations, which ones are better for other situations. I mean, they're all amazing solutions, and you've met a lot of them, I'm sure, during this conference. Yeah. But there's a rhyme and reason into when you want to bring them to bear. Given the population, what the goals of the employer are, and the efficacy and what's going on clinically with that population. And so that's where Quantum has really developed a lot of insight into helping them pick the right partners for them. And so the index really reaffirmed something that we've already been doing, and it helped us understand some of the trends and patterns and what would constitute utility and value to the clients that we serve. And so that was an affirmation for us to continue doing what we're doing, to continue with our preferred partner program, to continue working with the ecosystem, but really to use navigation as a core that binds it all together. When people present, they ask us for help, and then we can say, go here or go there, and let's get you over here. But we can also create an intimacy with these partners that we just make things work behind the scenes for the member. Because we really do want the member just to be focused heavily on their health and their well-being and taking care of their own self and their family, and let us do the mechanics. And so I think that's one of the things that we do, and one of the things that the index reaffirmed for us, and is very much a growing need within the marketplace.
Well, as the healthcare navigation market heats up, it's also getting fairly crowded. So to build on that, I want you to talk about how Quantum Health stands out from the competition and why their approach is, unique from other companies in the space.
Well, one of the things, as I said, we do have the history and the track record of working with all these folks over time. We do follow the data, but I think one of the things that Quantum is very exceptional at, and one of the things I love about the company, is that they unpack the humans that they work with. And they create that human-to-human interaction to understand what will resonate with them and what will actually work and what won't work. And so we do apply that understanding of a population to which point solution will work with at what point in time. And so that's unique, because at the end of the day, you want them to engage. You want people to use these services. That will drive ROI for the clients. It will drive a clinical outcome. It will drive a financial outcome. And also we can create what I would call a superlative experience in the process. I mean, think about it. How well do we go through the ecosystem today? We go through it like that childhood game of Marco Polo. Yeah. Marco Polo. How awesome would it be to have a navigator that's by your side helping you figure out the smart path through all of that to get the care that you need?
Thank you for the Marco Polo analogy.
You like that, huh?
Yeah, I like that. So I want you to talk a bit about the moves that Quantum Health has been making over the past year. So particularly in the family planning and musculoskeletal care virtual markets. What were behind those moves, and how do you go about selecting those digital health point solution partners?
Yeah, no, that's a great question. Well, first off, we start off with the anticipated demand, the need. So we hear this from the clients, we hear this from the members, we also see it in the clinical cost spend. We see where all the activity is. That's what leads us to some of the chronic conditions, MSK being one of the top, behavioral health being one of the top needs, especially coming out of a pandemic. Yeah. We know it's top of mind. Family planning is another thing that we get a lot of demand for. And so to us, that just signals there's an opportunity for us to sit down with these partners and really map out the operations between us to understand the workflows and how do I, as a navigator, make them more effective at doing what they do. And so that's really what led us to these partners of ours.
Excellent, makes a lot of sense. Well, Dan, thank you so much for your time today. I hope you enjoy the rest of health.
You're welcome. It's good to meet you.